Hi everyone, today I'm going to talk about the overview and classification of dosage forms. We will focus on the semi-solid and liquid forms only. So basically, drugs are not usually given in their pure chemical form, but they are prepared into different dosage forms by adding other ingredients. These ingredients help make the medicine to be more effective, stable, and easier for patients to use. So, a dosage form is simply the physical form of a medicine, like tablets, creams, or syrups. So by choosing the right dosage form is really important because in compounding, it affects how well the drug works and how safe it is for the patients. So in general, dosage forms can be divided into three main types, which is solid, semi-solid, and liquid, but like I informed, we will focus on semi-solid and liquid only. So first, let's talk about semi-solid. So these forms are in between the solid and liquid form, and they are usually applied on the skin or mucous membranes. Some of the examples are ointments, creams, and also paste. For ointments, they are very greasy and it forms a protective layer on the skin, which helps to keep the moisture in our skin. So next, creams are much lighter and it's less greasy, so they are much more comfortable and easily absorbed through our skins. Lastly, we have paste, which are much thicker because they contain more solid particles, so they can provide more protection on our skin. And then for the next dosage form, we have liquid dosage forms. So these includes things like solutions, suspensions, emulsions, syrups, and elixirs. In these forms, the drug is mixed into a liquid base. And one of the advantages of liquid forms is that they are easier to swallow, especially for children and for elderly patients, because children might be scared to actually swallow any pills or capsules, and also elderly patients might have difficulty and their muscle might be weak to actually swallow any capsule or pills. Other than that, they also act faster because the drug is already in liquid form, so by then it can be absorbed more quickly. However, there are some disadvantages. Liquid forms are less stable and can be easily contaminated by microbes, so they definitely need to have some preservative to avoid the contamination by microbes. And they can also be very bulky and less convenient to carry around. This is why people usually consume liquid dosage form in their own house because it's very bulky. So in conclusion, understanding different dosage forms is very important to make our medications safe, effective, and suitable, especially for our patients. Thank you.
Hi everyone, I am Putri Sofia, and today I'll be talking about the significance of official reference books in pharmaceutical compounding. So basically, in pharmacy practice, medicines can't be just prepared randomly. Everything has to follow proper standards and guidelines to make sure the medicine is safe, effective, and consistent in quality. That's why official reference books are really important for pharmacists during compounding and medicine preparation. One of the main references is the British Pharmacopoeia, or also known as the BP. The BP is legally recognized standard in the United Kingdom, which means medicines supplied there must meet the standards stated in the BP. So the BP provides information on things like identity, purity, strength, and also the quality control of medicine. It also contains detailed monographs for active pharmaceutical ingredients and formulated preparations. These monographs include information such as composition, preparation, methods, storage requirements, and quality standard. This is important because it helps pharmacists prepare medicines accurately and consistently. The BP is also updated every year to keep up with new scientific knowledge and advancement in pharmaceutical practice. Okay, so another important reference is the British Pharmaceutical Codex, or BPC. The BPC focuses more on the practical side of pharmaceutical compounding. It provides guidance on formulation methods, dosage forms, and also preparation technique. This is especially useful in extemporaneous preparations, where pharmacists need to prepare medicine based on specific patient needs. Even though the BPC is no longer actively published, it still remains an important historical reference in pharmaceutical compounding practice. So next is the British National Formulary or BNF. The BNF is widely used by healthcare professionals to support safe and appropriate use of medicine. It provides information such as dosage recommendations, contraindication, side effects, and drug interaction. The BNF is updated every 6 months to ensure that information stays current and evidence-based. In compounding practice, it helps pharmacists ensure accurate dosing and safe medication use, especially for individualized treatment. So overall, official reference books like the PP, BPC, and BNF are very important in pharmaceutical compounding because they help ensure medicines are prepared safely, accurately, and according to professional standards. That's all from me. Thank you.
Hi everyone, my name is Intan Susiana. So for this part, I'm going to explain how to perform pharmaceutical calculations. In compounding, when we scale a formulation up or down, the most important thing is we must maintain the same ratio between all ingredients. This is because the ratio determines the drug concentration, which directly affects its effectiveness and also safety. So the formula is desired quantity divided by original quantity and multiplied by the original ingredient amount. So this basically tells us how much bigger or how much smaller the new formulation is, and we can apply that same change to every ingredient. Okay, so let's start with hydrocortisone cream. The original formulation is 100 gram, but we only need 25 gram. So when we do 25 divided by 100, we are actually finding the fraction of the new formulation compared to the original, which is 1/4. So we multiply this fraction with the original amount, which is 25 over 100 times 1 gram, which gives us 0.25 gram. We will repeat the same step for the cream base because if we only adjust one ingredient, the ratio will be disturbed. Then we verify using percentage strength. When we calculate 0.5 divided by 25 times 100, we still get 1%. So this step is very important because it confirms that even after scaling, the drug concentration remains unchanged. Next, for scaling up salicylic acid and zinc oxide cream. Here, we increase from 120 gram to 250 gram. So, when we calculate 250 divided by 120, we are finding how many times larger the new formulation is. So, every ingredient must be multiplied by the same factor. For example, salicylic acid is multiplied to get 5.21 gram, and zinc oxide becomes 20.83 gram, and cream base becomes 223.96 gram. After that, we verify again using percentage. We will still get 2.08% and 8.33%, which prove that the scaling is accurate. Okay, so both of these calculations are for semi-solid, which is creams. We use weight per weight because both the drug and the base are measured in mass. For liquid, such as suspension, the formula used are just the same, but the difference is we use weight per volume because the drug is measured in mass while the final preparation is measured in volume. Okay, now for paracetamol suspension, we reduce from 100 ml to 50 ml, which means the formulation is reduced by half. So the drug amount must also be half to maintain the same concentration. That's why we multiply 2.4 gram by 50 over 100 to get 1.2 gram. Then we will verify using percentage weight per volume and we will still get 2.4%. And lastly is amoxicillin suspension scaling up. We increase from 75 ml to 180 ml. So again, we calculate how many times larger the new volume is, then multiply the drug amount accordingly. And this will give us 4.5 gram. When we verify, the concentration remains the same, which is 125 mg per 5 ml.
Lastly, I will be presenting the labeling and regulatory compliance along with the justification of auxiliary labels for our product. We prepare two formulations, which are a hydrocortisone 1% cream and a paracetamol oral suspension 200 mg per 5 ml. Firstly, both labels include all essential regulatory elements such as the patient's name, drug name, strength, quantity, duration of use, storage condition, and a beyond use date. These are important to ensure correct usage and patient safety. For example, the hydrocortisone cream is labeled as 1% weight over weight, while the paracetamol suspension is labeled as 250 mg per 5 ml, which helps ensure accurate dosing. We also included storage instructions and discard dates such as 14 days for the suspension and 90 days for the cream. to maintain stability and effectiveness. Next, for the auxiliary labels, for the hydrocortisone cream, we use for external use only to prevent ingestion. Keep out of reach of children for safety. And for the paracetamol suspension, we use for oral use only to indicate the correct route. Check well before use since suspensions can settle and affect dosing. These labels are selected based on the dosage form and route of administration to reduce medication errors and improve patient understanding. In conclusion, proper labeling ensures safe, effective, and compliant use of medications, while auxiliary labels provide important additional instruction. That's all from me. Thank you.